We'll discuss a case today. We got in our OPD. We can see this case on your screen. A male patient complaining, middle-aged male patient complaining of a skin lesion on his back. We have to diagnose the lesion first. For that purpose, it is advised in dermatology to describe the lesion first. Description of the lesion is important in dermatology. So when you look for the lesion in this patient of middle-aged male, so the lesion, how it looks is important. So you can see the location of the lesion on the back of the patient, and this is quite a single and large lesion, and this is angular or circular, and we can see there are this is erythematous lesion and with raised edges, and in between we have these pustules in between the lesion. And we asked the patient the history. So the patient said the lesion is increasing peripherally. So basing on the characteristics of this lesion, we can see a central clearance also. So we summarize these things. There is a circumscribed or annular lesion with raised edges, erythematous background with pustules in the center, and it is mildly scaly. So this is looking like a Tinea corporis, and we can see the lesion is quite large. We have to suspect some other conditions, like why it is so extensive. So we asked the patient the other history. The patient said he is suffering from type 2 diabetes mellitus. So in any patient having type 2 diabetes mellitus, it is the lesion will be quite large or may have recurrence, or else we can think vice versa also. Any patient who is complaining of recurrent dermatophyte infection or recurrent UTI, even with treatment it is coming back, we have to suspect diabetes mellitus nowadays. So this is one case, immunocompromised conditions, especially this type 2 diabetes mellitus. This is responsible for this non-healing of this lesion, and the lesion is quite extensive only because of diabetes mellitus type 2. And we can see in this picture there is some white things, white powdery like thing in the periphery. So this is due to the topical application, powder application by the patient. So this is one more finding in this case. So this is clinically a case of Tinea corporis. It is always advised in doubtful cases. It is advised, like doubtful case means if it is associated with some secondary infection. So for that time the lesion is not classical. So this is a classical lesion. So in those cases, if it is complicated with any secondary infection, where you have this confusion of diagnosis, so that time you can go for investigations. KOH mount is a basic investigation for this condition. So this is a case of Tinea corporis, which is non-healing Tinea corporis due to type 2 diabetes mellitus. Thank you.